I'm really excited to talk to you today, which it's our first time here talking about this, talking about anything, quite honestly, and talking about patient financial assistance, financial barriers, how we can overcome them. From a personal perspective, this is part of my job, and I'll get into that. And so it started as a project, and then it kind of became a passion project, and now it's just become a straight up passion. I think, I'm going to assume that we have some pharmacists in the room. I'm not going to ask for audience participation because I think that's frowned upon, so you don't have to raise your hand. But I would assume a lot of you are pharmacists, and if you're like me, before you went to the office, right, you probably started in a pharmacy. And I would guess at least half of you have had a patient cry at the counter or on the phone and have had these barriers. And so we think about how it affects the patient, but not as much how it affects the whole patient care team. So we're going to talk a little bit about that. And then we're going to talk about some solutions that, actually Srulik is going to get into some fantastic solutions about how we can make this better. So I'll give you a little intro about myself. I started a little bit. I'm a pharmacist, and I'm a Walgreens pharmacist. You'll hear me switch hats back and forth throughout the presentation between my regular pharmacist hat and my Walgreens hat. And I support our specialty pharmacy operations, and that's not just in our specialty pharmacies that are located in the communities, but also at our traditional retail. And that's where a lot of our focus will be today, because there are a lot of specialty patients that get served out of traditional retail pharmacies, and they need that care just like our specialty pharmacies. So we're going to divide and conquer and talk a little bit about both solutions.
Hi everybody, thanks Sarah. Excited to be here. I'm not a pharmacist, I'm an engineer. So I'm gonna take a different side of this. I'm not sure, but I'm very excited to kind of share with you our partnership with Walgreens and kind of a little bit about my background and our company's background. So I co-founded the company about 5 years ago. So engineering background, spent most of my time before that in the medical device space. And TailorMed started as a passion of mine as well, as someone who was the caregiver of 6 family members with cancer, and eventually kind of decided to combine my passion to help remove financial barriers to care and my day job in technology. And we'll be kind of sharing today a little bit about both the impact on patients and other stakeholders in the ecosystem, but also the behind the scenes of how our technology that is at the hands of pharmacy technicians and the Walgreens teams works in order to remove those financial barriers. So thanks.
Fantastic. So I think the best way to start this is to really use a patient journey, right? Set the stage, what are we experiencing today, and then take it into where we can go. So we'll start with Nancy. We have Nancy up there. Sorry, my old eyes don't get that far, so we have some cheat sheets in front of me here. We have Nancy, 61 years old, and she has a new specialty prescription. And you can see the cost there is quite extensive, and her share of that is $3,000. So let's take a minute. Scene, how does Nancy feel? I'm going to assume, well, if she did the Google, actually, before she even made it to the pharmacy, she probably has a lot of emotions right now when she saw that cost, right? She is scared. She has a decision to make. Does she pay for it every month? And then what happens when she's $3,000 out every single month? Does she not pay for it? And then what happens to her condition? Is it going to affect other conditions? I'm going to assume she's frustrated. I've seen patients myself. They're scared, frustrated. How is this going to impact me moving forward? I wouldn't want to be in Nancy's shoes, but unfortunately, a lot of our patients are in Nancy's shoes. And you can see here, there's a lot of numbers here, so I'll let you read those yourself. But Nancy is not alone. We know that healthcare costs are a major concern for a lot of our patients. A lot of the American public, as you can see, they're 27%, and a third of patients don't fill their prescriptions, right? And that's the focus of today, is that prescription abandonment and how that affects the entire healthcare system, not just the individual patient. Of course, that patient's the most important, right? They come first, it begins with them, it ends with them. But we're going to talk about how it affects Nancy's entire care team. We've all heard throughout the sessions that specialty is, it's pharmacy, it's the wave of the future, it's here, it's over 50%, upwards of 80% of new drug approvals. But with that, well, that's super exciting. It's novel treatments that we didn't have before. There's obviously a cost associated with it. And so we're seeing more and more abandonment in the specialty space. And you can see with some dollar thresholds there what we're looking at. 52% for an out-of-pocket over $125, and then it goes up for that $250. So I think that we have a great opportunity here, but I also think we need to look outside of the patient and see how else this impacts the health system as a whole. So we'll go to Allison. Allison is the doctor. So we have your basics with the doctor, right? If you don't have a happy patient, you don't have a happy doctor. But our providers are frustrated as well because they don't always have the tools and resources to help patients find financial assistance. So that's one thing, right? It's difficult to coordinate. It's difficult to keep your patient adherent to therapy. So that's the next piece of it. Outcomes. We hear I hate to call it a buzzword because it's so important, but outcomes, we heard about it this morning in a session, and it's very important. You can't even get outcomes if your patients don't fill their prescriptions. But it's going to affect Nancy's outcome if she has poor adherence, or if she doesn't fill at all, if she skips doses, if she naps her doses. We have specialty meds, as you know, that if you take a dose every other day instead of every day, it's not going to work. It's going to affect other disease states. If Nancy has other conditions, right? It could affect her high blood pressure. It could affect blood sugar. Just that general sense of well-being. Obviously, her quality of life. All of that is going to fall on her doctor's shoulders, right? So she already has those stresses as well. And then there's that burden on the healthcare system. And I do not want to call Nancy a burden because Nancy's not a burden, but you're going to have increased doctor visits. You're going to have hospital visits when patients aren't adherent. So we have a key player here that doesn't always make its way into that financial assistance circle, if you will, circle right there. But we need to remember that providers do want to know. They want to be filled in, and they want to be a key player in that. And then we have Jana. And Jana is where I can spend the most time. I won't, but I could, because Jana could be me, as I mentioned earlier. And I think that probably a lot of the concerns on Jana's side are very similar. It's outcomes, right? It's the patient's well-being. It's their quality of life. It's some frustration again as well. There's resource limitations, but this is where I kind of step away from that quality of life and that clinical part, and let's talk about, and this is what you're going to actually talk about in a minute here. What does it mean for the pharmacy team? So I know, I was there, you get really frustrated when you can't help your patients have the best outcome. Now, I was there a bit ago, I'll be honest, and things have gotten better. But when you have a patient and maybe you don't have all the resources to find the copay assistance, to find the foundations, you're limited for time. I think we all know that our pharmacies were strapped, right, during COVID. We couldn't take care of the population without that happening, quite honestly. And so pharmacists stepped up their game. They're already at the top, but who knew it was even possible? But they sure did, and we all saw it. But they're strapped for time, and we need to make things efficient for them. And so I think that's another key player here that we'll talk about when we talk about technology. But this is the way I kind of see those three pillars all working together. Anything to add to that and what you've seen in your experience?
No, I think that one of the things that we're seeing on all fronts, but definitely the pharmacy side, is how do you address those challenges for patients at scale. So obviously, with pharmacies at Walgreens and Alliance Rx, we're talking about a lot of patients, and unfortunately, as you stated before, these financial barriers is impacting so many patients. And so, how could Jana handle this at scale? And this is why I think that we're looking at technologies that really need to be proactive in a way that will address not only the pharmacy side, but eventually increase the outcomes for patients. And I think that another thing that we're seeing about providers, they want to help patients, but I don't know that they have the capacity to do that. So all of that together creates kind of a gap that we're trying to solve.
And it's just a revolving circle, right? They don't have the capacity, they're crunched for time, and so then we have maybe the patients skipping out because they're not familiar, and then it makes the doctor more strapped for time because they have increased visits, so it's a never-ending cycle that we're seeing more and more of lately.
So let's share what we do.
Yep, so we'll talk about what we do. And I'm going to talk about this a few different ways. I didn't mention this at the beginning, but I'll mention it here. You'll see this a little bit focused more on retail, but I'll also talk a little bit about what our specialty pharmacies do. So you can see we have different experiences working together in our different channels. So what I'm going to talk through right now is a retail experience, because that's where we see a lot of our specialty patients. So what we do today is, Nancy's prescription would get sent. Ideally, it would get sent electronically to the pharmacy. And once it got to that pharmacy, the pharmacist and their team would do benefits investigations. They would fill the prescription. And then they would contact the patient and let them know that it's ready. Now, if there's any sort of concern whatsoever, they're going to outreach the patient. They're going to get that feedback from the patient. Could be verbal, could be nonverbal. I think we talked about that already, and find out that they want help. And then that's where it changes a bit depending on what channel we're coming into. So I'll talk about this later in more detail, but we have some financial services teams in some of our specialty locations that will help with this. Retail, we don't have that because it's a different workflow and a different model. So they're searching whatever means they have, but nothing efficient necessarily. And then we're outreaching to the patient and telling them what we found. And then the patient opts in, and then they're coming back to us. And so there's a lot of back and forth, and it takes a lot of time. It causes frustration. Some of those enrollment forms are very difficult. They're lengthy. And so it's a manual process right now. And that's where that's where we stop. We stop that picture too.
Yeah,
so what can you do?
Yeah, so we started basically about a year ago to deploy this technology at 350 Alliance Rex Walgreens specialty pharmacies, and that basically allows teams on the pharmacy side to go in, search for resources, also be informed about the changes of those programs that can open up and close, and also be notified about those changes, and then, as you said, stop at that level of experience, and then facilitate enrollment on behalf of patients. But one of the things that we're seeing, and I think it's not only in retail pharmacy, but it's kind of an industry trend that we're seeing, which is healthcare consumerization. And we want to provide patients with the ability to be aware of what's coming next in terms of their out-of-pocket responsibility. But we don't want to just provide a very high cost estimate without giving them tools to be able to address those and remove those barriers to care. So one of the things that we are proud about this partnership is that we are not stopping at the back office pharmacy, but we want to go and provide patients the ability to self-serve to these programs and basically be able to be notified by the pharmacy or even automatically based on the threshold of high out of pocket, and who knows what's high out of pocket for each individual, and then be able to say, out of these thousands of programs out there, what are the ones that I'm eligible for as a patient, and then help them facilitate the enrollment and be able to eventually remove the anxiety or the financial toxicity and adhere to care. And I think that from a pharmacy perspective, be able to handle so many scripts that are being sent in the retail space where you don't have teams that can help with that. And I think that that's why we are passionate about working together, because there is a joint vision here that in every type of encounter and in every type of medication affordability issue, we want to provide the right tools at the right time to the right individuals, pharmacy teams, patients. That's basically what we're doing here together.
Absolutely. And you said something, go to the next slide, but you said something I want to build upon. We talked about how this impacts everybody, how it's a benefit, and you mentioned putting it in the hands of the patient. And that's not to say that we're pushing it off on the patient, right? We're not saying you take care of all this yourself, we're just going to free ourselves up. It's not that at all. But if I've been in meetings with any of you this week, you've already heard me talk about this, and I think actually in the outcomes meeting this morning, it was brought up by a few different people. It's really important to have a patient be a managing partner in their own healthcare. Having that autonomy and that control means so much when you have a condition, as we all know, that is just taking over your life. Being able to make decisions on your own and feel educated and empowered is really important, and that's what this does. So yes, does it help operationally? Absolutely. I'm not going to say no. I was a retail pharmacist for a very long time. But it also helps empower our patients and make decisions on their own, and then they can come back to us and ask questions.
And I think that one point, just to kind of complement that, is not only taking care of their care, but also do it as early as you can in their journey.
Yes.
So before they get that surprise meal, before they are burdened by the, or have the anxiety of when they afford it, trigger that something that can calm them down from a financial perspective. And we're not talking only about the patient, we're talking about multiple constituents within what we call the network. So maybe we can talk a little bit about the value for each.
How it impacts either. I mean, so from a clinician standpoint, right, that's how I'm looking at this now, back to the pharmacist instead of the Walgreens, right? So we know obviously the patient is happy. They have less stress. They're not going to be paying as much out of pocket. I feel like that's a given. I think we probably know that. But then of course it filters into the doctor and those outcomes that we were talking about. Knowing that her patient is cared for, knowing that her patient is being adherent because they're not stressed. knowing that Nancy can afford her medication, feels good about it. And of course, I mentioned the healthcare spend in general. So this will ultimately help decrease general healthcare spend. And then pharmacists are very similar in a lot of those outcomes. So personally, as a pharmacist, I would be happy to know that I empowered a patient to feel like they have some control over what's happening with their prescription. At the same time, it opens up the door for conversations. So you become managing partners together. You pull the doctor in. It's a perfect group there. And then obviously from the operational standpoint, it's becoming more efficient in the pharmacy. And again, remember, this is thinking of our busy retail pharmacies is what we're focusing on. At that point, then, we've made it a little more fluid for the pharmacy team members. Not as much time spent on the phone, being able to use their time where it should be spent, right, with our patients. I'd rather talk to them about their copay assistance and explain it and other disease things than spend the time on the phone activating cards or on hold, I guess, is honestly what we're probably doing. So that's my perspective of the pillars, and I'd love to hear yours.
Yeah, I think that the one that sometimes we see as well is that while we are working with pharmacies, the providers who are sending those prescriptions to the pharmacies are also eventually benefiting from that. Not only because patients are adhering to care, because they don't go back. And I remember a story I heard from I think it was a pulmonary physician before we even started the company. And he said, I had a patient that was feeling not well, and he came to me, asked for assistance, and I gave him an inhaler. And 3 months afterwards, he came back, and I asked him how you feel, and he said, not that good. And he said, okay, so maybe the inhaler didn't work. He said, no, I never took it because I didn't know how I'm able to afford it. And the physician told me, that was one of those things that made me start this company, is if I would have known, I might have been able to change the script or provide some assistance or refer it to someone who can help. So I think that eventually we really need to see how it's kind of impacting all of those constituents together.
Absolutely.
Have you seen kind of stories of our solutions being in the field?
Yeah. So we do visits. Actually, not myself, but some of my team was in the field just a few weeks ago and got fantastic feedback of how not only how simple the process is to find assistance, but how happy their patients are. Quite honestly, this is as most of you know, all of you know, with specialty pharmacy, this is key. This is one of your core services that you offer. So being able to offer to have a platform that's so easy to use, and knowing that we can enhance and that we work together to even make changes, but just where we started, because we just started our partnership. They're seeing time saved. They're seeing that time saved transition to their time with their patients. Everybody loves to look on a patient's face when you tell them that their prescription costs nothing or $5. So, I am very happy with how it's impacting patients, but I'm extremely happy with how it's impacting our team members. That's who I support. That's my customer, and so that makes me really happy to see.
Great to hear.
So we are going to get into the TailorMed network and solution for all this, but in order to do that, I wanted to kind of set up, now putting the Walgreens hat back on, what we have and what the offering is and how we're working together today, so that then we can segue into what some possibilities are for the future. So we have 3 channels where we service specialty patients. The vast majority of our prescriptions that we fill for specialty, well, I shouldn't say vast, I should say just about half, is in our retail sites. We see a lot of specialty patients in our retail sites. And so that's where we're focusing, is how do we increase the offering, because our specialty patients in retail sites need that same care and that same attention to detail that our specialty patients in specialty sites do. So that's our focus and where we're talking a lot about today. But where we've been already is in the other 2 down here at the bottom. So Alliance RX is our central pharmacy. And they do a fantastic job of using our clinical programs to take care of our patients and manage them. And then they also use TailorMed and find financial assistance for patients when they need it. And they do a great job of just taking care of that whole patient experience. And then you have our specialty pharmacies that are local in the community. So we have around 300 locations that are in localized areas. And they are a hybrid of sorts. So they're filling for the whole patient, both specialty and non-specialty. They are accredited. So these are accredited specialty pharmacies. They have your specialty drugs, your limited distribution drugs, but they're right there in the community. And so they're also using TailorMed So there's a lot of similarities to our central field, but there's a lot of similarities to retail. And so that's where we started because we had that hybrid experience. And so we are seeing, as I just mentioned, fantastic results with our financial assistance. I mean, in our last year, we were well over $700 million in financial assistance achieved for our patients. I don't want to say achieved like that was us, right? But that's what we found. That's what we were able to get them the medications that they need. And so I'm very excited to expand into retail, but knowing it's a different space. It's a different patient. They're a little bit, different drugs, and so that's where we're going to go, and where you're going to talk about what the capabilities are.
And it's a completely different experience.
It's a different experience, yeah. So this is our location map, and you can see there. But I think it's a great segue into just see into seeing the vision and seeing how TailorMed is going to help us out.
Yeah, and have you seen any kind of differences between you have so many locations, you're spread out across the country.
Yeah.
Differences in need from patients who are like in cities or rural areas?
Yes, differences in need. I think there's select disease states. Transplant, actually, we see a lot of need. So that's not different in different cities, but when I'm looking at different disease states, we see a lot of need in the transplant space and foundations. But also, of course, in our underserved areas, we see a lot of need there. But at this point, the financial barriers and the concerns are not discriminating. It's happening all over the country at this point. So I'd say not a lot anymore, like there was at one time.
So I think one of the things that we wanted to kind of share with you is the approach that we have taken, and I'm going to take a step back for a second. So when we started TailorMed in 2018, we were focused on oncology. We started in the cancer care environment, both in the specialty practices and hospital-based cancer center, simply because it's a high prevalence, high cost condition, and we saw also that there is already education around teams doing what is called financial navigation or financial advocacy. But over the last few years, we've constantly seen a pull from the market or from patients when it comes to other disease categories on the one hand. So we continue to expand to all specialty areas as a first step, but then we started seeing something that I didn't anticipate, the need for financial assistance in primary care conditions and chronic conditions. Although the prescription cost is not as high as a high-cost specialty drug, over time you're in need for refills, and a lot of patients are unable to afford that. So that allowed us to kind of scale on one hand on multiple disease categories, but on the other hand, that creates an opportunity to assist patients in other use cases. So not only within the provider setting and then across health systems, but also working with specialty pharmacies and retail pharmacies that we're now going into. And I think that over those years, what we've been able to build is a network. And the reason for that network is essentially what we're trying to connect is patients with relevant financial assistance. And how do you do that at scale? And one of the things that our thesis is, we want to make sure that every one of those constituents, patients, providers, pharmacies, and life sciences companies, and also foundations who are providing that financial assistance, are under one unified, we call it technological umbrella. Because when you have that, you have the technology to spot patients that have financial barriers and connect them with financial assistance in an automated and proactive way. But you are also starting to benefit from two things that we call our network effect. One is you're connecting more patients into the network. You have more lives that are processed by the technology. So you are inviting more partners into the network in the form of manufacturer partners. So we are constantly adding new brands and supporting their co-pay assistance, co-pay cards, co-pay foundations, free drug programs as well, in order to make sure that the enrollment of those programs is streamlined. And when you have that, you have a differentiated value compared to an Excel spreadsheet, which is something that a lot of times you would use before, and then that drives more partnership like the one we have and with others that we are constantly adding to our network. And that is, I would say, one part of that network effect. But there is another thing that happens once you start having those patients as part of the technology offering. You unlock opportunities to provide other values that are extending throughout the continuum of care, and not only focusing on financial assistance. Because once you have a patient that is concerned about the cost, and you provide them with a solution that can help them reduce that cost, you have now a patient that is onboarded to a digital experience that you can provide them with more help. So partnership that the one we have can extend to other use cases and needs of patients because you're already there and you're providing them with a compassionate digital solution in order to address their needs. So that's kind of the story behind our network, and maybe to be a bit more specific about what we actually do and how we do it. So what we like to call under the hood is basically the capabilities that the technology has. I'll go through that in a second, but basically the capabilities can be deployed in a variety of different use cases. It can be a pharmacist working with our enterprise solution or a patient that is working with our mobile phone. But at the end of the day, what the system does behind the scenes is that it starts by ingesting data. That's key, and that's hard. But you have to do that, and you need to be able to consume data from different IT systems. So an EMR on the provider side, or a pharmacy management system on the pharmacy side. And we then look at clinical data, demographics data, and insurance. And we then also do our own benefits investigation to complement that patient's profile with our own benefits. And what that allows us to do is first and foremost predict. And we want to predict the patient financial hardship. So we are projecting out-of-pocket expenses, not only to the level of a single refill or encounter, but we would like to look kind of broadly at the regimen. So if a patient has, a specialty care regimen with multiple drugs, we're able to kind of project what would be the cost of the next 6, 9, 12 months. And then that allows us to provide transparency. But as I said before, we want to make sure that we're coupling transparency with solutions. So that allows us to be proactive, or the user of the system to be proactive about which patients need the most help, and what is that help. So our system basically flags those patients and matches them with available resources in the form of copay cards, free drug programs, copay foundations, local and nationwide government subsidies, but also social determinants of health factors. So you can help patients with transportation and living expenses and nutrition bills, because that's part of the financial impact on the care. So all of that together is, I would say, the actionable part, and then the system allows for the facilitation of enrollment. So with our manufacturer partners, it's almost a single click. So you basically have all of the data, we're connected to the manufacturers and the hubs, and we are sending that away in order to get instant approval for those patients. In other cases, where we're either not connected yet, or manufacturers don't support that, we have the ability to facilitate automation of filling of forms. Because, as you said before, pharmacists and pharmacy teams are super occupied, and they don't have the time to fax it and kind of start writing it and then sending it to the physician. So we do that with e-signatures and digital capabilities in order to increase the utilization of available options. And then I don't think it's less important than track. So from your perspective and from leadership, to be able to see how many patients are in need, and how many of those actually receive assistance, and what is the impact on patient lives, but also what is the impact on you as an institution. So all of that is basically analytics that we're kind of powering on top of all of those digital solutions that can be deployed in a pharmacy setting, an IDN setting, a primary care office, or a specialty practice. So basically all of that. So that's the under the hood things, and I think that it's kind of scratching the surface of the automation that we can do. And this is why onboarding new partners into the network is so important.
That's amazing. And from a an operational perspective, you say all of that, and in my head I just see one-stop shop. So I think about all the barriers when we're assessing adherence for patients, and financial is almost always at the top. But we see some of my barriers. I can't come and pick up my prescription, right? And yes, there's delivery, but sometimes they want to come. They want to see a face. So transportation comes up a lot. Help with some of the medical co-pays, things of that nature, and the fact that that's right there. That's amazing.
Yeah, and I think that's the evolution that we started back in 2018 and continue to basically iterate until we get to a point that in every prescription encounter that there is a financial barrier. We have a coordinated approach across the network to try and reduce that barrier for the benefit of patients and also to our partners. And this is why we're so proud about the partnership with Walgreens that I think shares the vision. So we can take it into home infusion, outpatient clinics, specialty pharmacies, and retail. So that's basically what we wanted to share today. And any points before we open up for Q&A?
Oh my goodness, I don't think so, but I feel like when we open it up, more things are going to just fall out. So
we have a few more minutes. So we have a couple of mics. So if you want to ask a few questions, we'd be happy to. and we came prepared for a shy audience, so I'm going to ask the first question. I think that the title of this talk has been around financial barriers and prescription abandonment. I'm just wondering, like, trends that you are seeing from where you are standing about, abandonment. What's the impact of that for your organization?
Yeah. So I do think, and I sound like a broken record probably with everybody else here, but when the pandemic hit, that shot up. We had people that were losing income, that were scared to go to the pharmacy. There is a host of reasons. They actually weren't all financial. And so we had, the great thing about our organization is we already had some tools in place and we enhanced. One of the best that we have right now is that, and this is for our retail sites because I know we're focusing a bit there, is we have a sort of a call structure, a schedule, a portal, if you will, so we could check on those patients before their prescriptions do a refill check-in to make sure that they're coming, that they haven't had any problems. We weren't having these conversations in person anymore, so this helped the pharmacy really narrow in on who they needed to contact. And then to take that to the other end, when we did fill the prescription, if it wasn't picked up, we're going to call them again. And so we have a system in place for our team members to make it easy to kind of track. And then that opens up the conversation. Okay, you haven't come to pick it up, why? And then we go from there, right? So what's the reason? Is it because you think you feel better, and so you don't need to take it anymore? And so that's the reason. It could be financial, it could be, again, transportation. So we could attack or say what that problem was based on that conversation with the patient. And we've seen great success with that, absolutely. Patients like it. They sometimes you're scared to call and say you'd rather just let it go, walk away. So having your friendly neighborhood pharmacist know that kind of call to you has made a world of difference for sure.
And I'm guessing it's also something that has to do with trust. Because if you're getting in front of someone who you don't know who is going to offer you a $5,000 out-of-pocket reduction, having that friendly encounter. And is that the way you measure impact? Like how many patients you're able to assist?
You can measure, yeah, absolutely. And we do in the specialty pharmacies, very similar, but at the same time, we kind of had that built in already, right? Because we so tightly clinically manage those patients. So we took, the best pieces of that and so what would work well with our retail pharmacies. And that, so, we've had a little bit of experience with taking some of our specialty work and putting it to our retail, and that's why this fits really well too. It's the same thing.
You had a long but productive Asembia conference. Before we kind of dismiss the class, any questions for us? Thank you so much for taking the time. Thanks for the partnership, Sarah.
Thank you.